Gurmila Mahagat Professor Kerrigan. Níl náhas a bheith arm manis mar tá má wach marah tá má crí briste agus tá má clán briste. So, tá má crí antrán. My name is Ciarán Staunton. I'm Rory Staunton's dad. I'm also Kathleen Staunton's dad. And Kathleen and my wife Orlaith are back in New York because Kathleen is in school, there's exams, and life must go on. We are honoured to be asked to speak here tonight because sepsis awareness is a huge part of what we do. We could not miss the opportunity to talk about this life-changing issue, particularly here in Ireland. Our son Rory was 12 years old when he died tragically from sepsis. April the 1st, 2012. That was the day our life changed forever. Rory was a happy young man. He was 5'9". I usually say he's 160 pounds, but I know everyone will have to start dividing that up into stones. So save yourself the bother. He was 11.5 stone. He loved life. He was a great kid for everyone to see. At 11 years of age, he wrote a letter to the North Korean dictator asking why he could spend so much money on arms and yet he had people dying of famine. He was captain of the Daniel Webster debate school. He started the debate team in the school. He also started successfully a campaign to ban the word retarded or retired from his school. He was a great friend. He was a great brother, a great son. When he was a little boy, building blocks in the basement, one day he was doing himself and his friend Noah. And Noah was, I used to call them unindicted co-conspirators. And they were doing this big building one day, and we said, well, what is that? They said, we have recreated the scene where Martin Luther King was killed. We've built the hospital. But what we've done is, so we've built the hotel, but we've actually built a hospital beside the hotel so that his life could be saved. So we've reenacted the thing again. How often have we reenacted his own situation? If we could only have done something. The story of our Rory began when he fell, scraped his elbow, playing basketball. The gym teacher covered the wound, didn't send him to the nurse and didn't wash the wound. A little after midnight, we heard him thrown up in the bathroom. He was complaining about his sore leg. The next morning, my wife put him back to bed and coaxed him and he went back to sleep. The next morning he was very sick. He had a temperature of 104, couldn't get it down. No matter what medication we gave him, we couldn't get it down. We called his paediatrician. She said she would see him that evening. My wife, we brought him to the doctor, our paediatrician. He was very sick. Rory made his way to our office. The paediatrician noted that he was shivering. He had a fever. He had a temperature of 102 auxiliary. He had an extremely red throat. His pulse, she noted, was 140. His blood pressure was 100/60. Respiration was 36. We pointed out that his skin was mottled and blanched. She noticed that he had upper abdominal pain. He vomited a large amount of yellow fluid in his office. She dismissed her concerns and she said it was a stomach virus. Rory kept saying it was a pain in his leg that really bothered him. She referred him to ER for rehydration and diagnostics of gastric flu. At the emergency room, they noted all the same symptoms. They concurred with the diagnosis of gastric flu, ignoring any other symptoms. The following day, Rory's condition had deteriorated, and we were in constant touch with his paediatrician, who again kept telling us to get food into him. Later that evening, when his skin started to turn blue and black, his face turned yellow, we took him to the ER. All hell broke loose. All hell. People came running from everywhere. Came running and running from everywhere. 6:30 on Sunday, he died. He shouldn't have died. After his death, we were in despair about what had happened and angry that we had never heard of sepsis. Sepsis kills between 1/4 and 1/2 of a million Americans every year. It is the largest killer of children in the world. We decided we wanted to do something about it. Rory's story had been widely covered in media outlets, including the New York Times. We started working with the New York State Department of Health, Northwell Health, and Governor Cuomo. And in 2013, we announced new state mandatory regulations, Rory's regulations, which now require all hospitals in New York to adopt protocols to identify and treat sepsis. The protocols are evidence-based and demand sepsis training for all staff, including the lab. To date, New York State Department audit, as was recently quoted and said in the New York Times, the Rory's regulations have saved over 5,000 people in New York State alone. Just in perspective, there's 500 people in this hall. 10 times that number of people is what Rory's regulations have saved. We intend to have that in every state by 2020. Because as families, we have had to take to the street. We have driven the discussion in the United States. In 2013, we convened the very first ever United States sepsis hearing in the United States Senate. We went to CDC in Atlanta and engaged in real dialogue regarding sepsis awareness. And something that we can see, that sepsis in the United States, let's do a graph, similar to your own graph, was killing more people than AIDS, prostate, breast cancer, and sepsis. We actually had to design that map, that graph, because no one else had done it. We brought it to Congress. We also met with the American Teachers Association. We've also now in New York State, every pupil is being taught sepsis, washing their cuts and everything. So they're not just learning about AIDS, STDs, salt, fat, other things. They're learning about sepsis. Rory's law, education law in New York, is now being taught to 3 million students in New York State. That's a campaign we intend to take nationwide. Because we know if Rory had learned about sepsis, he'd have come home and told us. That's what children do. He was the man that at a very young age came home and told us we must start recycling. And after he told us to start recycling, he came along every so often and did a police inspection of our garbage and pulled us over. That's recycling. That's not. We learned. We were slow, but we learned. And that's what would have happened had he learned about sepsis. Orlaith and Kathleen wrote a book, Ouch, I've Got a Cut. And it's again for people to read to their children. It's on sale at Amazon. A number of schools, it's actually sold out on Amazon. It's available coming up. A number of schools have taken it. They're also showing it to the children. Our program has been already translated into 2 or 3 other languages. Roy's death was a wake-up call. His story was carried in the New York Times, Dr. Oz show, Today Show. People magazine made a video of it. That video got 1.6 million views. And I suppose the question will go to many, why do we do all this? How often do we ask ourselves? We do this because Rory shouldn't have died. We know that if one medical professional had thought about sepsis, when we brought him into them, he'd be alive today. We know that we ourselves checked him for meningitis, that everyone checks their children and loved ones for, checked him for tick bites, for everything we thought could injure him. But we as parents did not know about sepsis. We did not know the word called sepsis, nor the signs of sepsis. We also know that sepsis deaths are completely preventable. We are not looking for a cure for sepsis. Fluids, antibiotics at an early stage will save your life, our lives. But sepsis must be identified and treated in a timely manner. For every hour that septic shock is not identified, the body is losing 8%. It's a race against the clock if it's not got. Sepsis has no boundaries, and it certainly doesn't care what age you are, what race you are, what income you have. Sepsis is not an equal opportunity killer that lurks back there in our midst at every aspect where we are. We know that 80% of hospital cases are community acquired. In other words, when they presented at, I say, the front door at ER, they had sepsis in their system. And therefore, that death was preventable. Knowing that we know how important it is for the signs of sepsis to be out there. Rory was a flashing red light for sepsis. If you look at the stats that I called out, that was Rory. He had a flashing red light going like this that said sepsis. And yet, not one of the medical professionals that saw him the night he presented at his paediatrician, his ER, or the doctor that checked him for sepsis. People need to know about sepsis. We must educate parents, because after all, parents are the first people. We must get them to continuously rule out sepsis. It costs you nothing to rule it out. It costs you nothing if you're in with a doctor or other one saying, "Doctor, could this be sepsis?" Or the medical profession rule it out. Every life is precious, and as we know, there's no second run. It's over. Sepsis has been deemed a national emergency in the United States and in Britain. It is a worldwide emergency. Hopefully, shortly here, this will be done also. It shouldn't be the luck of the draw. When someone puts their sick child in a car at 8 or 9 or 10 o'clock at night to drive down the road to the hospital, or drive down the road to say, "I wonder if this hospital has sepsis protocols. I wonder if that hospital has sepsis protocols." It should be that any hospital you go to with your child, if your child or your loved one has sepsis, that is detected at the front door, and that's it. There's no second runabouts them. Rory was sent home. He presented perfectly. He was sent home. It is time for patient, family, nurses, physicians, everyone at all. It's everyone. It's no indictment of anyone. It's the role of everyone. We need to act, and we need to ensure that no many more Irish people die. The stats that we heard today from Professor Kerrigan was 50 people a day. And we must remember that that's the low number. It's like our number in the States is 2.5 to 5 million. We know that because a lot of them are under-recorded. So we know that 50 people a day a minimum are dying from sepsis. Sorry, it's 50 people a week, 7 people a day. Since I arrived in Dublin Monday morning, 21 Irish people have died from sepsis. 80% of that 21 had it at the front door and was detectable and should be alive. Those are the realities. We need to save lives. We need to ask, could this be sepsis? It is time for us all to say, there's a killer in our midst. And if that killer called sepsis was on 2 legs, and he or she was out there going village to village, town to town, cutting people's throats or killing them or otherwise, there'd be wanted posters up in every post office and bank, and there'd be news bulletins. Well, we have a killer in our midst. And I believe we need to go out and get that before that comes for us. Thank you.